Guys, look at this question on the deltoid muscle. So they have asked the attachment, nerve supply, action of the deltoid muscle, and they have asked about the applied anatomy also. Okay, this is for 5 marks that they have asked. And when did they ask this? November 2023, final exam of anatomy. Okay, so first of all, tell a little introduction because it's for 5 marks. Deltoid is a muscle. It is delta-like. That means triangular-like. It is a muscle. What is it? It's first of all, it's a muscle. It's of the muscle of the upper limb of the scapular region. Okay, so this is introduction. Now, what have they asked? They have asked the attachments. So where and all is it attached to, people? Yes, it is attached to the clavicle. So this is the clavicle. So this is the lateral part of the clavicle it is attached to. Then it is attached to the acromion process, which is the acromion process of the scapula. Then it is attached to the spine of the scapula. Okay, so acromion process is also of the scapula, spine of the scapula. So it is attached to what and all in the origin, clavicle, scapula, acromion process, scapula, spine of scapula at the back. Okay, and where is it inserting? It is inserting into the humerus, that is the deltoid tuberosity. Okay, so basics you have understood. Now anatomy exam means if you don't draw diagram, they will think you have not understood. So draw diagram. Okay, so now let us practice one diagram, simple one. So I'm going to draw bone here. Now bone, first of all, I'm trying to draw a humerus. So this is my humerus for the day. And here I'm going to draw the clavicle as much as possible. And here behind some wing of scapula and acromion process I'm trying to depict. Okay, so this is the scapula at the back. Okay, now I have to draw the deltoid fibers, which I will lightly draw. You can draw lightly in brown color. So this is going to be the deltoid. Okay, which is going to insert into the deltoid tuberosity. Correct? So you show like this something. Okay, so this just shade this as light brown or something in the exam. Okay, and then you label the parts. What and all labeling will you do? Clavicle, scapula, humerus, deltoid muscle, deltoid tuberosity of the humerus. Okay, this one you label as acromion process if possible. Okay, and then you write here right side anterior view shoulder joint. Okay, something like that you can show. Now coming to the details of the origin and insertion. Okay, so basically from the clavicle, which part of the clavicle, people? Lateral part of the clavicle. So lateral part of the clavicle, you have some things coming, some fibers. Then the acromion process. From acromion process, you have 4 septa. How many septa? 4 septa. You will not understand unless you look at the diagram. Wait. So look here. So from the clavicle you are getting, then from the acromion process, which is the process of the scapula itself, you're getting 4 septa. That is what the textbook says. You have to remember this, right? So the lateral border of the acromion process, where the 4 septa of origin are attached. So which part of the acromion? Lateral border of the acromion process, you can say. Okay. Then clavicle, which part? Anterior border, lateral 1/3 of the clavicle. Okay. Now scapula, spine of scapula, where is it? I'll show you the diagram posterior. So spine of scapula. So spine of scapula, you can see lower lip of the crest of the spine of the scapula. If you can write so much in detail. Okay. You're getting some fibers of the deltoid. Okay. And where are they attaching? Yes, they are attaching all attaching to the deltoid tuberosity of the humerus. Okay, so 3 septa are inserting here, but 4 septa originated from the acromion process. Correct? So what exactly happened? So this 4 is attaching as 3. So they kind of converge. Okay, they converge into 3 septa and they are inserting. Okay, so basically this from this acromion process, as you have all these coming, these 4 septa, etc. So this is a multi-pennate muscle. Okay. And these 4 septa are converging into 3 septa and inserting. That's what they are saying. Okay. Got it, people? See here they have shown humerus, how they have drawn the 3 lines here on the humerus. This is what? Nerve supply. Nerve supply, people, is the axillary nerve. Axillary nerve, where is axillary nerve here? So the still 2 pill 2 nerve here, it's the axillary nerve. It is supplying the deltoid muscle. The axillary nerve is coming from C5, C6, that is your brachial plexus, C5, C6 fibers, spinal nerve, cervical. So this is the axillary nerve. Okay, that's all you have to remember and say. Okay. Now, what is the next part of the question? Action of this muscle. How will this muscle help you? So basically, it will abduct the arm, okay, from the beginning, that is 0 degree to 90 degree. Abduct, I have put in red. Why? Because abduct means somebody is trying to kidnap or something, right? It's going away from the body. So that is why I have put red. Okay. So deltoid will do what? Abduct your arm. Okay. Arm. Okay. Then what else you will say? What else will it do? Some drama they have written here, people. What they are saying it is multi-pennate, and also it has a lot of strength and all that. Okay, you can add all this if you have time. Then what else does it do? It does medial rotation and lateral rotation of the arm. What does it do? Medial rotate, medial rotate towards your body, medially rotate your arm. Okay, and then laterally rotate towards the outside, you rotate your arm. Okay, so basically who is helping? If it is medial rotation, anterior only will help. Correct? It will flex means what? Angle will reduce. All right, so you do one thing, take your right arm shoulder joint and flex it, that is reduce the angle, make it towards your chest, that time it is your anterior fibers are working. Okay, and medial rotation, that is towards your body only you rotate, that is again medial rotation, that also anterior fibers are helping. Next, posterior fibers will help in what? Yes, just the opposite. Okay, extensor it is, and lateral rotator. Okay, now over. So what and all is the action? Tell now, revise. Deltoid, madam. Deltoid, no madam, it will abduct the hand, ma'am, up to 90 degree. 90 degree means if hand is here, arm, it can go up till here because of deltoid. Okay, so this is 90 degree. Just make it perfect 90 degree in the exam if you want to explain. So this is arm and this is arm. Okay, so it is abducting. Okay, so you can show like this, one man's face also you can show if you want. So drawing diagrams will get you a lot of marks. Okay, so this is abduction. Who is doing this? Deltoid. Then here you can say flexion, extension, medial rotation, lateral rotation. Okay, all that you can explain if you want. Okay, so we are done. Next, what else have they asked, people? Go back to the question. Attachment done. Origin, insertion done. Nerve supply done. Axillary nerve C5, C6, spinal, cervical. Action of deltoid muscle done. What are the actions? You just now saw. Abduction, very good, of the arm. Then up to 90 degree, yes. And then because of the anterior fibers, you have flexion and medial rotation. Because of the posterior fibers, you have extension and lateral rotation. Okay. Now let us go to the applied anatomy, which is the next part of the question. See, you don't have time to write so much. Okay, I'm just explaining a lot, but you have to quickly write all this. Okay, in the exam. Now coming to applied anatomy, you will give intramuscular injection to the deltoid muscle. Usually you will give in the left hand because people use right hand for daily activities. So they are giving in left hand here. You can see how they are trying to find the center of the muscle. Why? If you give it in the wrong place, what will happen? You will damage which nerve? Axillary nerve. Very good. Now, if somebody has an axillary nerve damage and the deltoid is affected, how will you know? Basically, they will not be able to abduct the hand against resistance. Okay. Now, if axillary nerve is damaged because of whatever reason, either because of shoulder dislocation or some fracture of the surgical neck of the humerus, basically if shoulder dislocation is there anyways, there is going to be a contour loss. What do you mean by a contour loss? Look at this beautiful shoulder here. You can definitely see this beautiful shoulder. This contour gets lost when if there is some problem with this axillary nerve, shoulder, or some deltoid muscle problem. Okay. Now, then coming to the deltoid muscle itself, it's paralyzed. What will happen because of axillary nerve damage? Then this person cannot abduct the arm. That much you will be able to say in the exam, correct? Now, let's go to the next point here, people. So if axillary nerve is damaged, there will be sensory loss over the lower half of the deltoid. So sensory loss also can be there if there is damage to which nerve? Axillary nerve. Axillary nerve. Very good. Very good. Deltoid. Axillary nerve. Very good. So badge-like area called as regimental badge. So in the 3 marks question, they will just say what is regimental badge. Then you will be like, what is regimental badge? So the police will have here on your shoulder, tap below your shoulder. Yeah. Regimental badge-like area, there is a sensory loss. So in that you will say, what is damaged? Axillary nerve. Axillary nerve. Okay. Point something about supraspinatus tendon they are talking about. Okay. Next, I'm moving on to the last part here. Basically, if arm is by the side of you and there is pain, however, if arm is abducted and there is no pain, this is called as Doban's sign. This is in subacromial bursitis. So if arm is by the side, like here, okay, I will show here. If arm is by the side, there is pain, okay, but if arm is abducted, There is no pain. So this is what? Barnes sign. So this is what, in which condition? Subacromial bursitis. So there is a bursa inflamed, subacromial bursitis. So you should understand the anatomy. Why is this happening? Because the bursa disappears under the acromion process. Okay. Too much information it became, right? Okay. So now let's go to this question and see everything we have answered. We are getting full 5 marks, no people? Yes, very good. So everything done. Attachment, nerve supply, action, applied anatomy of deltoid muscle, done. Bye bye.